So hi, this is Dr. Rahul Gulve, physio and certified Austrian chiropractor. So today we are with Mr. Prasad Garu. We have treated him almost ఎన్ని విజిట్స్ చేసామండి? 36
plus
14
plus 8
more visits. So we have given almost 55 visits.
Yeah.
The condition was, you can see in the previous video how he was. So almost 3 to 4 surgeons in the city, right? If
Yeah.
I'm not wrong.
Yeah.
So he had a pain and a severe disc bulge at L4-L5 and L5-S1 and radiculopathy to his left leg. So almost 3 surgeons in the city has been advised him for go for surgery, and we let's know from your own words.
Yeah, like as Dr. Rahul mentioned that I was advised by 3 doctors to go for surgery, which I was not convinced with, because what happened was sometimes what I used to do is to take some painkillers, and then that used to give me relief for a month or 2. Okay, and then again the pain used to start. So what I wondered was, when painkillers can reduce the pain, there should be some way without going for surgery to get this treated in whatever way. I tried multiple therapies and multiple medications, that alternate medicines, like Ayurvedic. I tried the same thing. I took it for 4-5 months. I stopped it for 2 months. Then again the pain started. So I experimented all in the last 2 years' time. Finally, I came to know through one of my colleague that something called chirotherapy and manipulation of bone structure to get the relief and physically set the structure of the bone in a right way to reduce and permanently relieve from the pain. And at the same time, I have done a lot of research. Me and myself have done a lot of research on the internet, and then found that in the western part of the countries, they very often go for the chirotherapy.
Okay.
So which is very well known in other part of the world, but unfortunately not in India.
Okay.
So that triggered me that yes, this is the last option which I can try in my life.
Last option,
Because I went through Ayurvedic.
Okay.
I went through something called Chakrasiddh.
Chakrasiddh. Yes.
Basically, they massage
Okay.
the affected area.
Okay.
But that again, the same problem. Like it gives me relief as long as the massage is going on.
Okay.
So even 2 days, 3 days break triggered the pain again.
Okay.
That didn't work out. And I tried Sujok Therapy also.
Oh.
But not for long. But even that I couldn't find any improvement.
Okay.
So finally coming here, like as I saw my own video the first day when I stepped in.
Okay.
It was basically I was not able to walk. I was not able to sit. I was not able to stand. If I lie down, I have to lie down on the left side where I had the pain.
Okay.
On the pain
you are
area,
comfortable?
I was comfortable to lie
On
down.
the pain side.
Pain
Okay.
side.
If you lie down in a right.
It used to shoot up the pain.
Okay.
So probably some angle was making me uncomfortable.
Okay.
So that again, if I lie down for more than half an hour on the pain area, I was not able to get up at all.
Okay.
It used to take 1-2 days for me to get up.
1-2 days.
Yeah.
Okay.
Yeah.
Oh.
But no other way I can lie down.
Okay.
So my complete life was disturbed. My
So
professional life, my personal life, my social life, all disturbed.
What do you do?
I'm an IT professional.
Your IT professional. Yeah.
Yeah.
How long the pain was started actually?
It actually started with a very mild pain. It was about 2 years ago.
2 years ago.
2 years ago. That was manageable. In fact, I didn't care about it.
Okay.
I thought maybe it's a simple overstrain of my sitting or my work pressure.
Okay.
And then after a year, it started troubling me more.
Okay.
So then I thought, okay, this is not temporary. I have to go for some permanent relief.
Okay.
So that then I experimented going to orthopedist.
Okay.
Fortunately, I have one orthopedist close to me.
Okay.
In fact, when I broke my tibia,
Okay.
he was the one performed the surgery. So I used to visit him very often.
Okay.
So first thing what he made is to get the X-ray.
Okay.
So he looked at the X-ray. He gave me medicines for 2 weeks, but was no relief.
Okay. How was the pain? What is the nature of pain that time?
It was a radiating pain.
Okay. Radiating to your left leg.
To the knee part,
Okay.
little lower to knee.
Okay.
Okay,
Radiating
right from lower back.
Okay. Right from lower back to.
Lower back, right under the buttock.
Okay.
Within the buttock, not under the buttock. Within. I can't make out where the pain is.
It is a sciatic nerve pain.
It passed through below the thigh.
Okay.
And then until little lower than the knee.
Okay.
So the remaining part was okay.
Okay.
I was no problem. Had no problem. And then what happened was, the medication did not work, and then I came to you.
Okay.
And then even there, I had a problem. Like after 1 week, it was severe, uncontrollable. Like I said, 2 days I could not get up.
Okay.
So I called up the same doctor. He said, let's do one thing. You go for a steroid injection.
Okay.
If it doesn't work out, then the only alternative is surgery.
Surgery.
So I went for the steroid injection.
Okay.
Which was given to the affected area.
Okay.
Between L5 and S1.
S1.
Okay. So that whole day I was more or less like immobile.
Okay.
Because the local anesthesia was given. And next 2-3 days was okay. But again, after 4th, 5th day, same problem.
Okay.
Then I called him up. He said, it'll take some time for injection to take effect.
Okay.
But that some time was no time.
Okay.
It was on and on and on. Then I called you again.
Okay.
I said, Dr. Rahul, this is the problem. What do you want me to do?
Okay.
So you suggested me to come down and talk to you.
Yes.
So that again, the second meet with you really motivated me as this is the only way for me to get rid of this pain permanently.
Okay.
So restarted the therapy again with you.
So you in the second meeting you got confident.
Very much.
So in the second meeting we have explained him actually. So he's having a structural related issue. So due to the long sitting, that too in a bad position, he had developed the disc bulge at L4-L5 and L5-S1 junction. And due to that compression of the disc, the nerve roots, which is coming out from that area, it getting compressed. And he has tried everything. He had tried Ayurveda, he had tried Chakrasiddh, he had tried Sujok Therapy, and he had taken a steroid injection in the spine. Still, the story remains same. The pain, the intensity of pain, is same, and he is not able to do all his activity. So when he came to me, I have simply explained him, like, as it is a structural related issue. A structural related issue cannot be solved through any sort of medication or any sort of injections. So structural related problems can be only solved through by doing manipulations and mobilizations through where we can correct the structure manually, and after correcting the structure we need to heal that structure through laser therapy and all, and we have to strengthen the structure and we have to maintain it. So after this is what we have said, right?
Exactly.
So
and one more point I very well recollected is I neglected the exercises what you have suggested.
Okay.
In the sense, like, I didn't do it in the frequency what you have mentioned.
Okay.
No, I was doing it as and when I had time.
Okay.
So that in fact slowed down the recovery. But now I am taking it very seriously because there is no other option. There is no escape route.
So he has consulted me, and after taking a 1 week therapy, you got break, right?
Yes.
So after 1 week of therapy, he take a break, and I think you haven't see much changes in the 1 week.
Yes.
So that much of severe problem he was suffering with. He is unable to walk. If you can see the video, old video, the day one which we have recorded, he is walking by tilting, right?
Tilting, I was not able to stand, I was not able to walk, I was not able to sit.
Oh, so after starting the therapy, as we know that the recovery time will be definitely depending upon the intensity of problem and the duration of problem, from how long he is suffering with, and within, as he had tried almost all every therapies and he has consulted doctor, surgeon. So I think you didn't get the confidence, right? This will help you out in the initial days.
Initial days, yes,
In the initial days.
Because I thought I tried so many. This is one of them.
This is one of them.
Yeah, yeah. But then I realized after following the regime you mentioned that exercises are must for at least 1 year.
Yes.
So that struck to me after second consultation with you.
Okay.
So me and my family decided that there is no other escape route.
Okay.
I have to follow whatever Dr. Rahul suggested.
Okay.
For me to get better.
Good. So then you developed the confidence.
Yes.
So how are you after treating you almost 50 visits? How are you?
I am a lot better.
Okay.
I am much more confident that for life I will not have any problem. But as you suggested, and I also suggest whomever comes to you, that take Dr. Rahul's suggestion seriously.
Good.
Seriously.
So what about the nature and the intensity of pain now?
Now it's a lot better. As I said, that I was not even in a position to sit, first of all.
Like this.
Second, I was not able to sit in a right posture. I was
Before.
always like, bending,
Okay.
okay, and sitting only one side.
Okay.
Because I could not bear the pain putting pressure on the left side.
Okay.
So now I am able to sit in the right posture.
Great.
Okay. Even not only for a few minutes. I can sit for
Almost
longer.
we have almost 30 minutes we have
Exactly.
in this position.
Exactly. Exactly.
So
And also second thing is, like while walking, this was severe pain.
okay.
The nerve root below the thigh was
Okay.
severe.
Is it continuous that time? Is it continuous, or after walking for few minutes
Yes.
you used to start?
Yes, after walking for a few minutes, the pain starts.
Okay.
It slowly increases the more I walk.
Okay.
So what I have done now is, I understood my own, changes in the structure.
Okay.
So every 10 minutes, just relax,
Okay.
sit for 2-3 minutes, then walk again.
Okay.
And that 2-3 minutes rest is sufficient enough to bear that pain,
Okay.
and that pain reduces.
Okay. So now how much time you are able to walk in a stretch?
I am able to walk in a stretch is about 15 minutes.
15 minutes with no pain.
Yeah. With
Before
no pain.
treatment?
Before even not even 2-3 minutes.
Okay.
Okay. Now I learned how
Okay.
to
Manage
control the
structure.
pain.
Okay. Great.
So I understood my own mechanism. Like after so many sessions with you,
Good.
that internal part is observed and controlled by self.
Self. Good.
Even though you are the one to correct my structure,
Yes.
unless until I give you the feedback, you will not know what is happening within me.
Yes.
Right?
Definitely.
So that is how your treatment is.
Yes.
So it has to be, what I understood from you is the interactive therapy.
Yes.
It is not that, you look at the X-ray, cut this off, done.
Yes.
Right? That's what.
It is not like that.
Yeah, it's not like that. It has to be a feedback system. Like,
Even though in the structure related cases, as we give a treatment with combination of therapeutic approaches, the patient has to maintain it. It is, the structure cannot be corrected within 10 days or 1 month or 2 months. The structure needs over a period of time to correct. As we discussed earlier, to heal a structure, definitely it should have a proper approach, and along with that, what we can see is the damage of the structure, intensity of damage. It also plays a major role. If you can see a small amount of damage in the structure, definitely the healing will be faster, and the structure, if it is it is damaged excessively, the time to heal the structure, definitely it will take more. So yes, can we see your walking, how you are walking now? Please, can you please open the door? I think your walking pattern is also changed.
Yeah, exactly.
So
The consciousness of pain made me walk as the structure.
bringing you towards, you have to come to the pain-free range and you have to walk like this before. So now you are walking almost, in a neutral pattern. Okay. So how much the, as we can see here, the universal pain scale. So he was on 10. So almost, as this is the last visit, we can say almost how much the intensity of pain was reduced?
Reduced by about 80%.
80%. So the surgery case and the case, where he is not able to, in a position to sit for a few minutes, he is not in a position to walk for a few minutes. So if he lie down, he used to take 2 days time to get up from the bed. So now he is doing all his activities, and as he said that 80% of pain reduced, and we have given enough breaks in between, right?
Correct.
Enough breaks.
So even with the breaks now,
Yes.
I'm able to manage the. There's no issue with the pain.
Okay. Even
after
breaks also.
Yeah.
Okay.
Yeah.
So
So the pain is the 20% remaining,
okay.
which maybe another 3-4 sessions will make me relieve completely 100% pain free.
Definitely, that structure, that 20% pain also, as the structure is getting corrected, as the structure is getting strengthened, that 20% of pain also, it will definitely go. Okay. So along with the manipulations and all, we have treated with him mobilization, Mulligan mobilization techniques, spinal and neural mobilization techniques, dry needling, shock waves, cupping therapy, and laser therapy, short wave therapy, and core muscle strengthening exercises, dynamic neuromuscular stabilization exercises. So we have treated with combination of therapeutic approaches, and this is a result.